last week we had a public meeting where Health and Human Services Commissioner Nick Toumpas laid out the plan to provide managed care for folks who are on Medicaid. As we've talked about before, nearly 45 states now manage their care for folks who are on Medicaid. In other words, they don't have a fee-for-service plan. In fact, they have more like an HMO-style program where folks who are on Medicaid actually have their care managed. And managed care companies are very adept nationally at reducing spending on Medicaid by essentially requiring preventive care to take place, by diverting people on Medicaid from emergency rooms to doctors' offices that are a lot cheaper, providing that care. But we had that first meeting last week, and what's really interesting is that even though one of the last states in, it's clear that a lot of people who are on Medicaid are getting word about this change and are taking action. Because this starts December 1st, and by the middle of last week, already 41% of those on Medicaid had chosen a provider. There are 3 large managed care companies that are going to manage Medicaid for New Hampshire. And in most states, when you give people on Medicaid an option to pick their own provider, usually only about 20% do. And then the state ends up randomly selecting the rest of the people into these 3 companies. But clearly we have a pretty focused population on Medicaid who are paying attention. And what's really going to be interesting about this program is, one, how well it works. Does it save the kind of money that the state budget is relying on it to save? A total of $16 million in total spending a year, $8 million in state spending. The second question is, what's Medicaid managed care going to look like in a long-term care setting? New Hampshire is going to be one of only a couple of states in the country that have ever tried this, to manage care for folks who are in nursing homes and are on Medicaid. These are very vulnerable populations. It's a very difficult balancing act for these companies to weigh. And people who advocates for senior citizens are very concerned about how this is going to work. And that's what a lot of this meeting was about. Commissioner Nick Toumpas assured folks there's going to be a lot of feedback, a lot of community meetings about this before it's actually rolled out, and that provided some assurance.